And good evening. It is so great to have an opportunity to see everybody this evening. My name is Sheila Caldwell, and I'm the president and founder of the Heart to Heart Foundation. We are a grassroots organization based in the Charlotte metro area. Actually, we're headquartered in the beautiful York County, South Carolina. So, for those of you who are joining us this evening, especially through our Facebook Live channels, we thank you so much. And for anyone who's watching this on the replay on our YouTube channel, thank you so much for joining us. And don't forget to hit that subscribe button so you can see more of our heart health educational videos. So tonight is one of our special series. It's one of my favorite that we do called Doctor Chat. And I am going to bring on our special guest this evening. He is Dr. Sushil Singhi of Carolina Cardiology. He's an interventional cardiologist, and we're going to find out what that means. And we're also going to find out a little bit more about the difference between primary and secondary prevention, because there is a difference. So, Dr. Singhi, feel free to unmute yourself. We'd like to get to know a little bit more about you. There you are. Awesome.
Good evening, everyone. Good evening, Sheila. Thank you very much for giving the kind introduction. Again, I am Dr. Sushil Singhi, an interventional cardiologist in this community. I've been practicing with Carolina Cardiology Associates for the last 28 years and serving the community. I'm a board certified in cardiology as well as in interventional cardiology. I have also been certified in sleep medicine. And we'll talk more about the connection between healthy hearts and a good night's sleep.
Absolutely. So we've known each other for quite a while now, and I've heard you tell the story before, but I thought it would be interesting for those who have not heard your story to find out what compelled you to become a cardiologist to begin with.
Sheila, it's just an honor and privilege to be with you in this program, and we have known each other for a long time. As you being a wonderful person and founded this Heart to Heart Foundation to help and outreach the community in this Tri-County area, and now you've extended to the state of South Carolina. Really, my heart goes out for you. First of all, February is a National Heart Month. I have really a lot of feelings about the February month because being a heart month. So happy heart month to everyone. Now, going back about 40 years, again, I'm not that old, but again, it's 40 years ago, my father had a heart attack when I was in my medical school. And I was freshman at that time and did not know much about the cardiology and heart attacks. My father really suffered from massive heart attack, and there was no treatment available in India at that time. So he did not get the proper care. And being a naive person, I made my conscious decision during my freshman year of medical school that I am going to get training in cardiology and become cardiologist. So here I am as a cardiologist.
And that was 40 years ago. And I found it interesting, and I know some of the research that we've looked at all of these years, I found it remarkable because I never would have thought of Asians of having such a high level of risk for heart disease, but it's actually pretty high among that group, isn't it?
Yeah, actually, the heart disease still remains number one killer in the whole world, especially from Asia and from my own country. They have some hereditary issues in terms of having the low HDL, which is a good cholesterol. Also have some biomarkers are very high, and that prone to have a premature atherosclerotic heart disease. So obviously, the people from India and from that part of the region have higher incidence of heart diseases compared to westernized country.
And we find that among different ethnic groups, Asians being one. African American, Native American, and Hispanic. Does anybody know why those ethnic groups are more predisposed to the risk factors that lead to heart disease?
I think I must say that it's not only the genetic predisposition they have, but also they have acquired risk factors. And I call those risk factors as a modifiable risk factors, which include number one, obesity, number two, lack of exercise, number three, increased incidence of diabetes, number four, smoking, number five, cholesterol issues, and more importantly, the lack of preventive care for those risk factors, which easily can be modified and lower the risk of heart diseases.
So for me, and you and I have talked about this before, the fact that about 80% of the risk factors that lead to heart disease can be prevented or managed, which you just shared, that gives us a reason to hope that we can save lives and we don't have to lose so many people to heart disease every year.
Absolutely. I have a few recommendations to start and then we can go into detail. Number one is to stay active. This can be as simple as taking a walk. Number two, get tested for prevention or get the screening process done. And we can talk more about the calcium scoring and so forth. And number three is be aware of your mental health, because mental health is very important. The stress, especially during this pandemic time, a lot of factors or risk factors can be multifold increase by having just the stress and you don't know how to deal with that. Also, very important, eat healthy food. Eat well, move more. Folks will live longer. And last but not least, practice gratitude. It can keep blood pressure low because these are the very, very modifiable risk factors. And 70 to 80% of the time, if you modify these predisposing factors, that will lead to healthy living.
It sounds pretty simple. And I think a lot of people hear that and they think that's all there is to it. And it would seem that if people would embrace that, and I often say it has to start here and then get here for people to make this part of their lifestyle, but it is possible. Why do you think it is, considering that heart disease is the number one killer of women and men around the world, not just here in the US? But why do you think it is that so many people don't receive that message and take steps to prevent heart disease?
Sheila, one thing I must admit that is easier to say than to be done, and you have to do it on a consistent basis. Where there is a will, there is a way. You have to make commitment for yourself and have empathy for folks in your family, your loved one. If they have suffered these heart diseases, then you got to change for yourself. One of the most powerful risk factor, unfortunately, is a non-modifiable risk factor. It's a genetic predisposition. So you got only is a modifiable risk factors that you can work on it. And you got to work on it early on. The heart disease, especially the blockages in the arteries to the heart, start very early on, very early on. So our eating habit, blood pressure, salt intake, stress, cholesterol, smoking, exercise, that should be part of your daily activities. Just like you guys eat, we folks eat every day, same thing, you have to follow those guidelines and everything has to be in moderation. But you have to be very careful. You are in this world, number one killer remains the heart disease. And it does not look at the age all the time. I have seen folks in their 20s. Trust me, Sheila, I have seen the folks in 20s having a massive heart attack. So this thing is deadly, is a killer, but most of the time having discipline, we can alter the course of disease and we can all live healthier lifestyle.
A common question that we get, and I'll pose it to you, is, we talk about one of the foundations of good heart health is nutrition. It's what we put into our bodies. What kind of eating plan would you typically recommend for someone to help get them back on track?
I think it's a very good question because we eat every day. Sometimes we eat more than one time or more than three times a day. It's 24/7. the scientifically, let's talk about some medical science. Mediterranean diet, which includes salmon fish, legumes, nuts, that will lower the risk of having heart attacks and may alter the plaque formation in the arteries to your heart. So that's one of the few diets have shown to reduce the incidence of heart diseases. Now, going forward, I would suggest that watch your sugar intake, watch your carb. The carb tastes sweet, but if you have excess of carb, it acts like a poison. So just remember, the sugar is not good all the time. You have to be in the moderation. So carbs can convert into the fat by your healthy liver, and then it goes into the arteries to your heart and adds to the plaque formation to the arteries, and that can lead to heart attacks and certain time cardiac arrest and death. So diet, what I suggest is we have a very active Dean Ornish-based program in this community. Sheila, you're very, very well aware of it. I have taken the course with Dr. Dean Ornish in California, and the diet was the most important thing for altering the coronary artery disease or blockages in your heart. So that whole concept, healthy lifestyle, is based upon plant-based diet. I know it's tough for our folks. I've been a co-medical director of this intensive cardiac rehab program at Carolina Cardiology Associates for the last 3 years. And I'm proud to say that we have had several hundreds of patients have participated in this active cardiac rehab program, 9 weeks of program, twice a week, 4 hours per session, 2 sessions per week, total 72 hours for this whole program, based upon the plant-based diet, exercise, behavioral modification, stress management, and group discussion. And science has suggested, after doing a lot of research, that having these disciplines, having this comprehensive rehab program, it changes the plaque or the blockage morphology. And also there is a regression of these blockages. And more importantly, the events, subsequent events of cardiac problems, including heart attacks and so forth, is much less. So my message to the community here, that make sure you eat well and move more, and we can live longer and healthier.
So if the intensive cardiac rehabilitation program, that follows that primarily the plant-focused eating plans, if that would work on somebody who's already had a cardiac event, would it not also work well for the people who have not had any kind of cardiac event?
I think it's a very, very interesting thought process. Let me just classify this prevention into the primary prevention and a secondary prevention. What I mean by primary prevention means you never had any heart issues or any cardiac events. And to minimize the risk of those events, we have to take some prevention. That's a primary prevention. And what we are talking here on the other hand is a secondary prevention, where after having the cardiac events, to minimize the risk of having recurrent events. So this is secondary prevention. In my opinion, Sheila, the prevention is the best cure for any diseases. Just to hear me out, just like we in the real estate, you look for location. For your well-being, the most important thing is prevention. To start, if you haven't had any cardiac events, then you start with the primary prevention. The primary prevention is very gratifying because you don't get crippled and you minimize your risk of having cardiac events, and you can continue to live healthy lifestyle. So primary prevention includes, again, the diet, which is low carb, low fat, medium fat, and some protein, and make sure your calorie counts is very well balanced. Regular exercise, at least 3 times a week, 30 minutes to 45 minutes. Make sure you have to deal with the stress. It's not easy, but if you put your heart there, just like we do for secondary prevention, we have yoga teacher, certified yoga teacher, who teaches yoga and meditation to our participants at the intensive cardiac rehab program at Carolina Cardiology Associates Rehab Center. This is a unique program. We are the only one in South Carolina who offers this comprehensive program for the well-being of our participant here who have had cardiac events. We have recently started traditional cardiac rehab programs. So I just want to make sure we don't get confused. This is all for the secondary prevention. Secondary prevention at Carolina Cardiology Rehab Center is a traditional and intensive. Traditional is a less aggressive rehab program for certain folks. And intensive, as name suggests, is very intense program, which is 4 hours per session versus 2 hours per session for traditional rehab program. There are pros and cons for both programs, but certainly there is more benefits with the intensive cardiac rehab program which is a more comprehensive and very, very intensive to alter the course of the cardiac diseases and minimize the subsequent events, cardiac events for the participants.
So circling back to primary prevention, at what age should people start practicing primary prevention?
I think, there is, unfortunately, I must say that our obesity in the community, in this country, our country, is become big issues. And as you know, obesity starts from school age. I'm talking about very, very early on. So first of all, make sure they get proper education. All the children should get proper education about the diet and exercise. So as soon as they start eating food on their own, they should start taking all the precautions from that age.
I know I've read that about 1 out of 4 preteens, teenage kids in this country are already pre-diabetic. And that's a scary thought because, unless, and many of them don't know it, but unless there is some kind of early diagnosis and intervention for those children, they're looking at a lifetime of being plagued with chronic disease. And what do parents and grandparents need to know about how to monitor their child's health and at what point they need to get help in intervening on those issues?
I think that parents, grandparents, and also pediatricians should also have a sort of collaborative approach and have a shared decision kind of stuff for any child, from starting from age 6 or 7, and have them a good education, just like the sex education in the school starts from age 12. So I would put more emphasis on this prevention aspect of cardiac disease very early on, because that's what the mind starts thinking about the diet and so forth. And I agree with you, Sheila. Our 1 out of 4 children are obese. As a matter of fact, in my clinic, in cardiology clinic, 40% of my patients are obese. So the root cause problem for a lot of diseases, including heart diseases, diabetes, high blood pressure, sleep apnea, cancer, is obesity. And if you don't watch from early on, then it gets worse. Old habit never dies, Sheila. So you have to act on it sooner the better.
I know among those like me out in the community that try to educate families about primary prevention, one of the comments that we get quite frequently is how culture plays a part. We have decades of families of people that were kids, now they're adults, who have grown up on overly processed foods, fast foods, convenience foods. How do you help them overcome that? And you talked about the behavior modification. And I think that's a big part of it, because you've got to undo all of those habits that they've had all of their life. And that's what their taste buds are used to. That's the marketing and the advertising. That's what they're drawn to. How do you help them get past that to adopt a healthier lifestyle?
It's $1 million question. Nobody knows this answer, and it's not easy to educate all the folks around here. And partly, I believe they themselves never learned all those things from their parents. And it's not easy to educate their own children. Therefore, I'm saying it's a shared responsibilities with the teacher, parents, and pediatricians. Start early on, gives children some education. Hopefully, they can live longer with the healthier than what they are now. So don't forget that we do have a lot of nutritionists, dietitian in this community. However, there is a significant shortage in this area, and it's across the country because it's a time-consuming process. It's very frustrating initially because folks been eating for a long time, and those good food, healthy food, does not taste as good as McDonald's food. So you have to be very careful. It's a very, very time consuming and reassuring, re-emphasizing and education. I think if you start early on, I think that has some potential to change the pandemic of having obesity across the world.
I would totally agree. And of course, as part of primary prevention, we talk about good nutrition, we talk about moving more, all of those things very, important. Not smoking. You mentioned the mental health component. You also touched earlier on screenings. So let's talk about what kind of screenings you should have as part of primary prevention and at what ages you should start getting screened for heart disease.
I think with the technology, Sheila, we have one of the best screening tool is calcium scoring, is a coronary calcium scoring. In simplified terms, means how much plaque person has by having a low dose CT scan, CAT scan. It takes about a few minutes to get it done. There is no preparation needed. You can go with food, without food, and result comes out instantly. And that is in my opinion, that's the best screening test, which is a non-invasive screening test to detect coronary artery disease or coronary artery plaques. There's a lot of research behind it. It's been well studied in a prospective studies that having a calcium score can assess the risk of having heart disease in the future.
Would this be the coronary artery calcium scan? Would this be a screening that someone might want to have when they're trying to make a decision about whether or not to take a cholesterol medication?
Yeah, one of the best indication or motivation, rather, I should say, is by knowing the calcium score. And once our folks know if they have a high calcium score, they'll be more compliant and more motivated to stay with the program and having medications like statin, blood pressure control, diet, lose weight, stress management, all those risk factors, what we discussed earlier. I think they would be more able to be compliant and eager to follow on a consistent basis because calcium score does not lie. It tells you the risk of having a heart problems, including death. So once they know what they are dealing with it, then it's sort of a wake-up call for our patient that they got to change for better. So I still believe not the stress test, not the EKG, but having this simple calcium scoring of the arteries can lead to a lot of diagnosis as well as the compliance plan for our patients.
At what age should a man or a woman consider having a calcium scan done?
So one of the best indication for this screening test, Sheila, is anybody who has adult, obviously 21 or older, and has 2 or more risk factors of having premature coronary artery disease, like family history, having diabetes, high blood pressure, high cholesterol, lack of exercise, and smoking. Once you have 2 or more risk factors, then they should go on for this calcium scoring and assess the potential risk of having heart diseases. And hopefully physician can have a game plan for our patients that what they should be doing, what they should not be doing it. So adult 21 years of age with the 2 risk factors. I think that would be and asymptomatic, obviously. They are the best candidate for this screening tool that we have to offer in this community.
So if they have it as a younger adult, but say they score 10, for example, which is a very low score, how often should they come back to have that redone?
Having a low score, the best score is 0, means you have no plaques, no blockages. We start worrying when the calcium score comes out to be 400 or more. And if you have score of 10, it still is in the low side for the age group and for the sex. But having a 10 is not 0. So you have to start thinking about modify your lifestyle. Make sure you get yearly cholesterol level checked, blood sugar level checked, do exercise 3 to 4 times a week, watch what you put in your mouth, and then don't smoke. I think you can start early on. And I would recommend not to do, because again, there is a small risk of radiation with the CAT scan. So I had to be very careful, especially in a young female. So although it's a low dose radiation, but it accumulates and puts some risk for our patient. So I do not recommend for at least for 10 years having a repeat CAT scan. If somebody has a score of 0, we usually don't repeat it, by the way, unless they have more risk factors as they grow older. However, somebody has 2 risk factors and a calcium score of, let's start from 100, 200, 300, then you modify your diet. And if the risk factor changes, then you go ahead and repeat your CAT scan for the calcium scoring. So there is no guidelines that how often you should repeat the calcium scoring. But if the person has already started all those modifiable risk factors, then I don't think he needs or she needs to have this CT scan on a yearly basis or every 5 years or every 10 years. We have done this calcium scoring on a patient who sort of become non-compliant with the treatment plan. So we again repeat CAT scan and again reassure them, or at least tell them that your risk is still high. You need to be compliant with your treatment plan. So, and also sometimes if you start those statin cholesterol medications like Zocor or other statin medications, Crestor and so forth, Lipitor, there is a regression of a calcium score. In other words, that tells you that this plaques, what we have, if you maintain all those modifiable risk factors on a consistent basis, it can lower the risk of having heart attacks. So it has some prognostic implication in that regard. But I do not repeat calcium scoring on a regular basis because of the risk of radiation.
It's exciting to think that there is a very simple screening that doesn't cost a lot of money. We know that insurance doesn't cover it yet, but it's still an affordable screening that can help catch heart disease at its earliest stages, because that's saving lives. And we know that this scan has saved lives. As far as like getting your blood pressure checked, your cholesterol checked, your glucose checked, at what ages should we begin to do those simple things?
My recommendation, again, goes back to the pediatric population, Sheila. Checking the cholesterol because there is some familial train for having a high cholesterol diabetes problem, could be type 1 diabetes or even type 2 diabetes. So routine blood tests should be done in all children, especially if they have risk factors on a yearly basis. The sooner you make the diagnosis, better would be for them. So my recommendation is it has to be started by pediatricians. And I have really yet to know that pediatricians are not sort of having enough literature for themselves to follow the protocols, because most of the studies done in this country or across the world, they do not include pediatric population for coronary artery disease. I think, I would like to take a different approach because we know that the heart disease starts early on. Therefore, we are focusing on a pediatric population. Let's get some testing done. I'm not talking about invasive testing or CAT scan. I'm talking about just a routine blood test. Check the blood pressure, for God's sake. Check the blood pressure. You may be surprised. The amount of salt our pediatric population eats, you will be amazed. And it's a counterproductive. And they have early onset of high blood pressure, which is undiagnosed because nobody has checked the blood pressure in that age group populations. So Sheila, having said that, I cannot overemphasize that you have to start screening from early on, as early as you can.
There have been studies in the last couple of years that have shown, and you already know this, of course, that in our preteen population, we're seeing more type 2 diabetes, high cholesterol, high blood pressure, strokes. I never thought I would live to see the day that we would be talking about 10-year-olds on cholesterol medications or 11-year-olds having strokes. That's just another testament of how badly we are taking care of our bodies because of all of the added sodium and the other ingredients that don't nourish our bodies. And this is what's going into our children. And if this is happening to them at this age, what kind of future are they going to have?
I think we have to change some of the recommendations for the entire population and also for teachers and for the pediatrician, and have some data available for them. First, we have to educate them. Once we educate them, then it'll be easier to have children can understand better on a consistent basis. So my thought is that we have to discuss with the entire those groups that we just talked about and have them follow those guidelines and do the routine checkup. At least check the blood pressure. There is no side effect of checking the blood pressure. Make sure they have a nutritionist or the dietitian counseling available. And also make sure they have a psychologist. Make sure they have some therapist. This is again, I'm coming back, Sheila. Prevention is the best cure. You don't want to wait till you have a heart attacks and other issues, congestive heart failure. You have to minimize by taking all these precautions and having proper education via the school medium or by pediatricians or by the parents. We have to provide resources. We have to have enough nutritionists in the community because this obesity, again, is very common, more common than you can ever think. Especially in the state of South Carolina, and some few other states, it's becoming like every other person or child has issues with obesity. And I bet any money that it's not just from genetics, it's more is the environmental and not having proper education, not having the resources, not having this nutritionist or dietitians or having enough help from pediatricians, teachers. I think all can lead to really bad outcome for our folks at younger age. We see a lot of patients in their 20s and 30s are having massive heart attacks. And don't forget, Sheila, the patient who are younger, they do not have any backup. They do not have any collateral supply to their good arteries or bad arteries. And once they do not have any collateral supply or backup plan, they have serious issues, including having cardiac arrest and death. And younger the patient having heart attack is more risk than older patient having heart attack, because older patients do have some backup system, some collaterals, good arteries have supplied some new arteries to the bad arteries or clogged up arteries. And most of the older folks, they get some prevention or they get the preventive care from their physicians or family physicians. But I'm afraid that the pediatric population did not have any preventive care for the heart diseases. And when they go into the adulthood, they are having significant risk of having this issue, and especially if they are smokers.
And I would presume that for those adults that, even young adults that come into your practice, by the time you have diagnosed them, they are well on their way. They are so far into the process. It's not that it's impossible to stop the progression of the disease, But as you have said before, they've got some work to do, to do that.
It's a hard work. It's a hard work. But again, there is a will, there is a way. You have to take care of your own health. But nowadays, there is so many social medias available. Our kids are technologically savvy and they have a lot of resources. So it'll be better for them to teach on the social media how to take care of themselves for the prevention point of view for the heart diseases. And that can be easily accomplished once we have collaboration with the teachers, parents, and pediatricians.
I would completely agree. So we have the primary prevention, which really boils down to what you put into your body, and what you do for your body is the primary place to start. Getting those screenings early, knowing your numbers, getting that coronary artery calcium scan if you have 2 or more of the risk factors for heart disease. One of the questions, and I was watching a television special last night on heart health, and one of the things that they brought up was the need for the advanced lipid profile, specifically the lipoprotein little a. Can you talk to us a little bit about that and what that screening is and what it would mean?
Yeah, so one of the routine lipid profile or cholesterol checkup, which includes total cholesterol, LDL, which is bad cholesterol, HDL, which is a good cholesterol, and triglycerides. Those are the routine lab work, which usually we follow them. However, if you're going into the more advanced lipid profile checkup, one of the tests that you just mentioned, Sheila, is a lipoprotein little a, which is the most atherogenic particle in your blood, causing rapid or acceleration of blockages in the arteries. So lipoprotein little a is very dangerous when you have a high level of lipoprotein little a in your blood that has shown independently of having an increased risk of heart attacks, congestive heart failure, and cardiac death. The good news for lipoprotein little a is there is no separate treatment, Sheila, or any medication that would just target to lower the lipoprotein little a level. But most of the statins have shown to decrease the amount of lipoprotein little a in the blood, and that also along with the lowering the bad cholesterol and a total cholesterol. So lipoprotein little a is very dangerous, but it can be easily treated with the statin.
From what I've read on the lipoprotein little a, and I have several friends that is what was the cause of their cardiac event. My understanding is it's genetic, so you can pass it down to your children. So if you find out that you have an elevated lipoprotein little a, do your kids need to be tested as well?
Yeah, unfortunately, yeah, you can do those testing, but having a high lipoprotein little a in the pediatric population, unfortunately, the statins are not studied. So below age of 18, the statins have not been studied except in a homozygous hyperlipidemia, which is a severe condition where your total cholesterol is over 500. Your LDL is over 300. In those population, which is very small, thanks God, very small, but those are exceptional to give this statin. And nowadays we have a new treatment, relatively new treatment called PCSK9 inhibitors. These are the non-statin shots, just like insulin shots we give below the skin. Similarly, once a month, we can give the shots, and amazingly, it has shown significant reduction in all the cholesterol, including total cholesterol, LDL, lipoprotein little a, significantly. And sometimes it's more than having statins on board. And we do treat a patient with this shots once a month, and pretty soon will be one shot every 6 months that will lower the total cholesterol by 50%, LDL by 50%, and triglyceride also by 20%. And we use these things where patient cannot tolerate statins, or we have not accomplished the target goal of LDL being a 70 for secondary prevention. So we have a combination of therapy with a PCSK9 inhibitor and a statin. These are the two different classes of drugs to lower the cholesterol for our patients. Now, having said that, it has again not been studied in a pediatric population. But once you identify that the patient or there is a risk factor for children, then they should be tested as a baseline. And remember that, unfortunately, there may not be treatment for that cholesterol issues, but at least the parents are aware of having these issues with the children. All parents love their children. So once they know the cholesterol level is high, at least they will modify some diet and get an appropriate dietary counseling or nutritionist and try to manage some other modifiable risk factors, including smoking, have a regular exercise, lose weight, avoid obesity, stress management, so they can concentrate on other risk factors. So in essence, that we plus that it will lower the risk of having events for our young adults if they start early on in their pediatric age population. I hope it's making sense to you, Sheila.
It does, and it's hopeful news that it's, and I know it's a very small percentage of the population from what I've read that have this issue. But for many, I'm one of the survivors, have Heart Champions with Bob Harper. And Bob, if you know Bob, Bob's probably the most physically fit person you've ever met, but it was the lipoprotein little a that caused his heart attack a couple of years ago. And we have other friends that have gone through similar things. So knowing that that is there, but also knowing that there is preventative measures we can take if we have it, whether our children are under 18 or if they're adults now, like all of our kids are, or, if we have it, that if we're identified with that there is still things that we can do. So that gets me back to that, that hope that we have that we can save lives through primary prevention. One question regarding young women. I am reading more and more that we're having more young women in their 30s and 40s having heart attacks. And a lot of that goes back to SCAD. Can you explain to those watching this webinar what SCAD is and how it's affecting younger women?
Yeah, it's a full form for the SCAD. It's a spontaneous coronary dissection. It's a very serious condition, by the way. Most of the folks who get heart attacks, there is a rupture plaque. They already have a blockage in their arteries to the heart. And when the blockage breaks loose and attracts the blood cells and platelets, then it forms a blood clot, and that clogs up the arteries and gives heart attack. Now, this spontaneous coronary artery dissection, so-called SCAD, is much more common in female. Much more common in female, and unfortunately is in the younger population, especially in a childbearing age, during the delivery, during the stress, during the labor, and so on. The arteries, the heart arteries starts have a spontaneous tear and can lead to the massive heart attack. Overall incidence is low, but certainly stress is one of the major factors for female to have this SCAD, and it can be potentially life-threatening condition.
Is there a way for a young woman of childbearing years to know if they're predisposed to that?
Certainly, all again risk factors comes into the play, what we just talked about that, but it's not the plaque. It is just without having significant plaque, there is a tear or shear force and the artery lead to the dissection or the flap in the artery, and blood gets clotted inside the flap and plugs the artery and leads to the heart attack. To consider any woman in labor conditions or after the pregnancy or any significant stress, you have to modify all those risk factors, what we just talked about. And unfortunately, we can diagnose early on after having the SCAD, but it's not easy, or it's almost impossible, Sheila, to have any kind of testing to detect that patient is a high risk of having SCAD, or spontaneous coronary artery dissection.
Thank you for that. That is one of the common questions that we get from younger women that follow us. So we've talked about primary prevention. We touched on secondary prevention. And as you know firsthand, I am a big believer in cardiac rehabilitation. I often say it is the difference between surviving and thriving after you've had a cardiac event. So walk us through, for a person who has had a cardiac event, tell us first of all what kind of cardiac events would qualify for cardiac rehabilitation and why it's so important, because we have so many women in this country, they're not going to cardiac rehab and they're not completing it. And we know that that's going to be a big difference in life or death for many of our heart patients. So talk about a little bit more about secondary prevention.
I think the rehab, cardiac rehab, especially secondary prevention, is the paramount for any patient who have had cardiac events. There are hundreds and hundreds of literature and the studies that I can quote that, based upon those positive data to prevent subsequent events after having cardiac events, including heart attacks, congestive heart failure, poor heart function, valve problems. There are 4 valves in the heart. If they have needs a surgery for the valves, they also become candidates. Having all those things after bypass surgery, after stents, after heart attacks, after congestive heart failure, increased heart size, all need cardiac rehab. As a matter of fact, the guidelines by American College of Cardiology, this is the class 1 indication. What it means, everybody after having these events, cardiac events, they should be offered 4 phases of cardiac rehab. And the phase 1 starts right after the events while you're in the hospital. So you can see that how important for our folks are having the rehab. Rehab, just like for the stroke, how important it is to get back to the on your feet, hopefully. Same thing where the cardiac rehab has shown that attending this either traditional or intensive cardiac rehab program, it will minimize the risk of having subsequent events. And as a matter of fact, your quality of life, your thinking process, your psychological issues will help and get help by this attending the rehab programs. Therefore, all the activities and the agencies we have, including American Heart Association, this organization, American College of Cardiology, put having a rehab is a number 1 indication for our folks. What we do in this session, if there is a traditional cardiac rehab or intensive cardiac rehab program, our goal is to educate the patients from dietary counseling, exercise, behavioral modification, including cessation of smoking, and having some group session to improve their well-being. And more importantly, they are more aware of problems that they didn't know before. It's easy to take medications, but don't forget that a number 1 killer in our country remains heart diseases. So medication helps, but most of the time doesn't prevent you from having another heart attack. Medication helps you not to have symptoms of chest pain and so forth. But if you're going to have a massive heart attack, you have to attend the cardiac rehab, especially if you already had events. So answer your question, after having any heart attack, small heart attack, big heart attacks, heart failure, valve surgery, after having stents in the arteries, or after having valve replacement by open heart surgery or by the stent in the valve, or having dilated or big heart lead to the congestive heart failure, they all should attend, if they can, the rehab program.
Amen to that. I'm a big believer. And as you know, not only am I a heart attack survivor, but I've also been the caregiver for, my husband when he went through his procedure a couple of years ago. So how can the caregivers, whether it's a spouse or a parent, a loved one, how can they help the heart patient get through that part of their lives? I got an email yesterday about a mutual friend whose husband just had a heart attack around Christmas at age 36. And he is entering that stage of depression. And she's reaching out saying, how do I help him as his spouse? So, talk to us about what caregivers can do during this process of secondary prevention.
Yes, the spouses or loved ones or the caretaker, they also needs to be educated. Part of Carolina Cardiology Rehab Center, we have a special sessions for caretaker, loved ones, and for spouses. We teach them what to look for it, how to cook properly, how to cook healthier, how to exercise for your loved ones, what to watch, what is the symptoms that he can have or she can have. So again, it comes down to education, education, and education. So we do have, it's a part of the rehab program where we invite them in the group session. They also listen to our speakers, caretaker over there, where they learn how to cook right. They have recipes online. We send them recipes and exercise plan so they can watch. And actually, it's more helpful for themselves too, by the way. Spouses, if spouses are not healthy, how are they going to take care of their loved ones? So it's like a buy one, Sheila, get one free. So that's what I recommend, because this is an educational process. And very often we have seen the big success because the caretaker or spouses are the one who prepare the meals for our patients. And if they're not cooking right, our folks are not eating right. And they have risk of having heart attacks or some heart issues for the future. So we do concentrate through our nutritionist and a dietitian for them and provide a good education, how they're going to prepare the meal and so forth.
You are so right, because typically, being a couple, it's usually both of you together and getting through that. So as we have a few minutes left, I'm just really kind of curious. We see a lot of reports in the news that people are not going to the ER, or they're not calling 911. And I hope this has changed over the last couple of months because of their fear of going to the hospital because of COVID-19. What would you like to say to anyone who might be sitting at home having symptoms that are hesitant to call for an ambulance or go to the ER?
I think is a real problem is unprecedented events time for everybody. And I'm hoping that after having vaccination, we'll have a better understanding of and control of this coronavirus or C-19 virus. But you're right, folks are afraid to go to the emergency room because it's usually crowded and they don't want to be exposed to the C-19 or viruses. So my suggestion for them would be that anybody is having symptoms. Before having symptoms, Sheila, let me talk about the preventive care. Nowadays, with the Carolina Cardiology Associates, we have given an option to our patients. They can have a virtual talk just like we are talking on a Zoom. We have a services where they can just enter their ID, and we can be online just like you and I are talking here. So we can talk to them and then suggest their game plan for prevention. Now, also there are some national health services available online. If you're having any symptoms, I would still tell you to go to the urgent care or emergency room, because once you're having symptoms, you don't know, your loved one doesn't know how serious this can be. There are only few things you can do online or on a Zoom or on your EHR. I would still urge, if you are having symptoms and if you have risk factors, you definitely seek for help, either urgent care or emergency room or your primary care physicians. But there are some national services available, at least it opened up in last year and a half, where you can access to them. Most of the insurance companies are reimbursing for the healthcare online. So that's not a big issue. I would get some help as soon as possible. And also don't hesitate to call EMS or the ambulance, because they are also very well equipped and they're professionals. So they can come at least check the vital signs, including blood pressure. And most of them have capacity to do the electrocardiogram at the site where you are. So at least we know that and they will transmit those EKG findings to the ER physicians and then to the cardiologists, and they can assess is it better whether chest pain is having massive heart attack or not. To answer your question, if you have risk factors, if you're having any symptoms, it needs to be addressed in a timely fashion.
We do have one comment from one of our viewers that said that stress is such a factor, and gratitude, and that she was very glad that you had mentioned those two things. But because we do know that right now, especially in the last year, people have had so much stress coming from so many different directions. In closing, you want to give us your best advice for, I know doctors are always saying you need to find a way to manage your stress. And for some of us type A personalities, that's easier said than done. But what is your best advice for finding balance in life, but helping us to manage that stress?
Very good question. Stress is considered and has been proven to be major risk factor for heart attacks. I'm not saying that stress can cause blockages in the arteries. I'm talking about the heart attacks when the plaque breaks loose and attracts the blood clots and plugs up the arteries and gives a massive heart attack. Stress can also lead to massive heart attack without having any significant blockages in the arteries. There is a well-studied entity, which is again for the female, mostly for female, and mostly for stress conditions. When they have a tremendous amount of stress, they can have a massive heart attack without having any plaque rupture or without having any significant blockage in the artery. And the condition we call is a broken heart syndrome, Sheila. This is just the latent, I'm talking about the broken heart syndrome. In medical literature, it's called Takotsubo cardiomyopathy. And that's 100% related to the excessive stress. 9 out of the 10 patients of having this Takotsubo syndrome or broken heart syndrome are females. So I cannot overemphasize that you have to deal your own stress. I have not met Sheila who does not have any stress. Some people have more stress, some people have less stress. It doesn't matter what degree of stress you have to manage by yourself. And what I say, I'm a man of a few words, Sheila, is never postpone your happiness. Happiness relieves the stress. Some people like to listen to music. Some people like to read books. Some people like to watch movies. Some people like to do exercise. Some people to go out. Whatever helps you to relieve the stress, whether it's yoga, meditation, not food, by the way, but or smoking, having exercise, meeting with the friends, all those things relieve the stress. And once you know how to deal with your own stress, then it will lower the risk of having heart problems. And some circumstances, Sheila, they may need help with their psychotherapist. I'm not kidding, but some folks have a lot of stress, especially the females. They need to get help sooner than later, because this Takotsubo syndrome or broken heart syndrome, people do die from that. And it's easily manageable if you know how to control stress.
I think that is wonderful advice. I appreciate your time always so very, very much. And our time is over, but thank you, Dr. Singhi, for giving us your advice and for wrapping up so beautifully for us to find our happiness. On behalf of our sponsors for our Doctor Chat, which is, of course, Carolina Cardiology, Comporium C&2, Healthy Blue South Carolina, and Williams & Fudge. Thank you so much for joining us. You can catch the replay of this program on our Facebook page. The live stream will be there, and in a day or so, we'll also have it posted to our YouTube channel. You can subscribe there, and please share it. We want you to share this, because the more people that share this message, the more people that we can help and we can spread this hope. Thank you, Dr. Singhi. We will see you soon.
Thank you, Sheila, for having me. Have a good night. Thank you.